I'll be explaining along. Okay, whatever we will discuss. Okay. Okay, so this is fine. Dr. I hope you're here and you are able to follow me. Okay. So this is fine. Then we have okay, date of birth is okay. I'm writing Trojan graph cross. Cross, not cross. Cross is the second name. You have to write Brendan. Brendan is the first name, right? So write Brandon. I'm writing to urgent graph Brendan, whose features suggestive of rheumatic fever. Before the assessment and management would be greatly appreciated. On today's visit or consultation is the same thing, right? So you can just write on today's consultation or on today's visit. One thing would work. Okay. Brandon again, okay. Brandon has presented with the symptoms of, okay, complaints of prolonged PR interval on ECG and increased levels of DSR and ASOT with no change in his previous symptoms, okay. On the state, again, this is Brandon, okay. Presented with the complaint of fever, sore throat, lethargy, and many crying spells with enlarged tonsils and cervical lymph nodes, after which diagnosis of tonsillitis was suspected. And for his penicillin and paracetamol, and for this penicillin and paracetamol were prescribed and review after 5. Okay, so again, the same mistake you guys are making. So this is like never-ending sentence. You have made a sentence which can start from Pakistan and it can go all the way to UK or maybe Australia. Okay, this long. Okay, we don't need these sentences because the chances of making mistakes are very much high if you make longer sentences. I would prefer if you could just break the sentences into 2 3. Okay, the paragraph, you don't need to write 100-line paragraph in one sentence. That is not a requirement. Okay, and that doesn't show that you are a really smart student or you have really good accent or English. That doesn't matter. Okay, but if you will write proper sentences, then they will understand that you know how to write English. Okay, longer sentences, complex thing, it doesn't take you anywhere. Chances of making mistakes are high the way you are making here. Okay, so I would prefer ending sentences here. So, and then, okay, lymph nodes, let's fine. Then you can write, therefore, a diagnosis of tonsillitis was made. Okay, and he was prescribed penicillin and paracetamol. Okay, and was asked to or for a review after 5 days. Okay, these things are important, guys. Please focus. Okay, I mean, I am telling you guys on daily basis that don't make these mistakes. But if you keep on making the same mistakes, then the problems will remain with you. Okay, then on this date, Brendan mother, not Brendan mother, it's Brendan's mother. Okay, was concerned. What is this? Because remember, there is no BCS. Okay, I told you guys. Okay, as he was not eating well and complaining of fever, right knee joint pain, tiredness, and lethargy with temperature 39.2 Celsius and enlarged tons. Again, see the same mistake, the never-ending circle is moving. Okay, it's like starting and you have made your mind that you're not going to end your sentence until the letter is finished. Okay, so it's very very silly mistake. Okay, please don't do that. Lethargy and fever, just write that. Okay, you just have to be smart if the things are little bit complicated. Okay, like with temperature 39 point, if you're unable to manage sentences like that, just write with fever. Temperature, high temperature means fever. There is nothing that you can say his temperature is 40 but he doesn't have fever. I have never heard about this thing, right? Okay, but then definitely if you say that his temperature is high, eventually you're saying that is fever. And the light tonsil is small in right knee joint. Okay, he had mild systolic murmur for which ECG. Okay. For which ECG, FBC, and ASOT were ordered, and Brufen was prescribed. And see again, never-ending sentences. Really, really bad way of writing. There is no problem in your English in here, but the problem is that these gigantic sentences are very poor way of writing anything. I'm not against long sentences, but if you'll make long sentences, the chances of making mistakes are high, and you are making small mistakes in between, and you're losing your score. But if you could just end your sentence, okay, there should be a pause, and then you can start a new one. So then you can gather information and you can write appropriate and compound sentences. Brandon had a history of allergy to nuts. So he had a history. He doesn't have allergy right now. Have you ever seen anyone who is allergic to something? Like, see, allergy is what is it is a hypersensitivity reaction, right, to something. Okay, like if you say that someone has an allergic asthma, okay, like he has allergic asthma, so you can't say that when there are pollens he won't get allergy. The chances are there that the episodes can decrease, or you can give a prescribed medication, but allergy won't go anywhere. If someone is penicillin allergic to penicillin, would you say that I will give the penicillin to that patient? Okay, because I think he will not be allergic after 5 years. He will still be allergic to penicillin. You can't take any risk. So this is not had, it's has a history of allergy, and it's gonna continue. It's not gonna end anywhere. Okay, and even you have written that 2 years ago he had anaphylaxis. Okay, so if it means that he had, it means it's done. Now he's completely able to eat nuts. Okay, then he will again present with anaphylaxis. Okay, please focus on these things. Okay, giving you guys examples so that you can focus on these points and enhance your English skills. Okay, in there's no in view of the above, I would be grateful if you could further assess and manage him accordingly. If you have any queries, please feel free to contact me. That is also missing. Okay, Dr. Wafa. Overall, if I say there are not many mistakes when we compare English skills, but the problem is that this exam demands a structure. Okay, and for that you have to write, proper way, proper sentences. Okay, try to end your sentences and try to write your paragraph. At least 3-4 sentences should be good. Okay, if you can't make smaller ones, but I would prefer if you make 4-5 sentences in a single paragraph rather than making one paragraph or one sentence. That is not a good idea. Okay,